Welcome to Waziki Health Talk. My name is Tele and I work with Waziki. On today's call, we have Dr. Laomi. We also have Dr. Kende, and we'll be taking you through, the topic of the day, cervical cancer. How does it affect you? How does it affect? How should you be prepared for it? How do you prevent yourself from, from it being too late? And we'll take you through that. Dr. Kende, I see you're here. I don't know. Would you like to get started? I think the first question I have for you, and I think I want this to be as conversational as possible. I know that a lot of people. I had a little conversation in the office the other day. I was asking, does anybody know what cervical cancer is, and do you know how it can affect you? And people had an idea, but they didn't actually know what the impact was. So, Dr. Kende, are you there?
Yes, I am. Good afternoon.
Hi, Dr. Kende. I was hoping you could take us through, what is the cervix? Just for the purposes of those who don't really know, what a cervix is and where it can be found, can you please take us through that?
Okay. Good afternoon, sisters. I guess we're all female in this group. Okay. What is this? The cervix. Okay, the cervix is the mouth of the womb. A woman has what we call the womb. The womb has a mouth. That area of the mouth, the passage, is the cervix. So when a woman lies down and you want to look into the vagina, when you pass there is what we call pass an instrument, you call it speculum. So after you pass that speculum, the first thing you see is the cervix. In a layman's language, it is the doorway to the womb. That's the simple logic about where the cervix is.
Okay, thank you so much. I will also pass over to Dr. Laomi. Dr. Laomi, just in your own words, so that people can understand. I know for some they find it a little difficult knowing, where parts of their, where some parts of their bodies are. But I don't know if you can, maybe if there's anything else you'd like to add to what Dr. Kennedy has just said.
Thank you very much. Like you said, the cervix is actually a tube that connects the uterus to the vagina. It's also called the neck of the womb, and is the most lowermost part of the womb. Actually, according to explanation, it's the same thing you see when you want to examine the vagina. Once you put your speculum, you're going to see a hole down that has a small opening. That's actually the cervix. And the cervix has two layers, the ectocervix and the endocervix, which is actually very important in the course of cervical cancer formation, because where they meet is called the squamocolumnar junction. Where they meet, actually, if that place is exposed after it has been transformed, if it's exposed to carcinogen, that's where the risks for the cervical cancer actually occur. Thank you.
Okay, thank you so much for that. Dr. Laomi, I don't know if you could take me through, what exactly is cervical cancer? I think a lot of people, would like to know, just, if we're not sure what it is and, how it presents itself. Can you give me, just a simple explanation of what cervical cancer is and what are the stats behind it?
So you said?
I said, what are the stats also behind cervical cancer? How prevalent is it in our society?
Cervical cancer is a malignant tumor of the cervix, which is defined as the neck of the womb or the lowermost part of the womb. It's the second most common cancer in women and the commonest cancer of the female genital tract. It's the deadliest but still the most successfully treated form of cancer if detected early. And it normally occurs between the 5th and 6th decade of life, that's 50 to 60 years. But you may also see it in women aged 35 to 40 years because of the HPV, that's the human papillomavirus infection. Then also women that are immunocompromised, that's like the women with HIV or those that have been exposed to a drug called diethylstilbestrol in utero. The main cause of cervical cancer is the human papillomavirus. most of the time, cervical cancer is asymptomatic, especially in the early stage. It's when it gets late, when it's entering the late stage, that's when we start having symptoms such as postcoital bleeding, that's bleeding after sexual intercourse or during sexual intercourse, or bleeding in between your menstrual cycle. Like maybe you've just finished your period, then 2 weeks after, you might be bleeding again. Also, bleeding on examination. This is because the cervix actually during that period is, we call it friable. That means on contact, the person bleeds. At late stage, the patient might start presenting with symptoms such as pain. That's because it has advanced and it has gotten to the spinal cord. The patient can present with chest pain because it has can present with urinary or fecal incontinence, and so many. There's actually no particular way to know apart from screening. HPV, that's human papillomavirus, as I said, is the cause. It's actually a sexually transmitted infection of which condom has no protection over, as against the normal condom protects from sexually transmitted disease. This is because the condom doesn't cover the scrotum. So whenever there's contact with the labia and scrotum, that is when it's transmitted. We have risk factors for cervical cancer. These include especially those that have sex before the age of 18, women with multiple sexual partners, women that have just one partner, but the partner has multiple partners, or when you have a partner that have high risk for cervical cancer, maybe he has already had contact with a woman with cervical cancer, so already have the human papillomavirus. Then smoking. This is because of the influence of nicotine in cigarettes, which suppress the immune system. Also, long-term use of combined oral contraceptive pills. Then people with family history of cancers, especially cervical cancer, breast cancer. Then people that have previous history of sexually transmitted disease, pelvic inflammation, inflammatory disease, multiparity, and early age of first birth. And those are risk factors for cervical cancer. Thank you.
Wow, that's quite a lot. I think, a lot of people, especially those who are married, a lot of people, fall within, the people who have risk factors. So you're saying once you're sexually active, even a condom doesn't protect against cervical cancer. And I think once you're saying is once you become sexually active, you're pretty much exposed to it. Can you please take me through what are the potential outcomes, right? So if someone has cervical cancer, what happens to them? What can happen to them?
Okay, thank you very much for the question. I said cervical cancer is not something that occurs rapidly. Before a person comes down with cervical cancer, it's going to take a long time. But before that, the person will come down with like as in small symptoms. On examination of the cervix, that's why the screening is very important. On examination of the cervix, you might just notice the cervix is not looking, especially for someone that really knows what a perfect cervix looks like. You might notice there is an abnormality in the cervix. That's why you take the script. The outcome of cervical cancer, depending on the stage. In the early stage, the outcome is very good actually, because it can be taken care of either by surgery or other modalities of treatments. But at late stage, the outcome is actually very bad.
When you say bad, how bad?
At late stage, there's already metastasis. There might be metastasis to the lung already, to the spinal cord, even to the rectum, so that a person might come down with fistula. Either it comes with rectal or vaginal fistula. Then it's just palliative. We are just trying to support the patient. So for the little time you have alive, we're just going to keep you and make sure you're in comfort. Because at the end, the osmosis system is that So depending on the stage it's found, which we pray it's going to be the early stage so that it can be taken care of. Even at the late stage, if it's early late stage where it hasn't really metastasized, you can just do a total hysterectomy and the person is good as new. But when it has metastasized and you can't really control, the patient might end up, dying.
So what you're saying is that one of the treatment options is to completely remove, the womb and all the reproductive organs of the person.
Yeah, that's one of the treatment options for cervical cancer, but that depends on the stage, the age, as the woman finish giving birth or not, the fitness of the patient. Those are factors you put into consideration before you consider total hysterectomy, because you can't just make that kind of treatment modality for a patient that is young and has not even completed a family size. So it's has to depend on what you get from your clinical staging, the age of the patient, has she concluded a family size, and so many other things, the doctor's capability, the treatment modalities available, how fast the cancer is spreading after you've done your histology, before you can think of total hysterectomy for a patient.
So what you're saying is if the person hasn't had any children, with as long as it's early enough, they might be able to do something about it. But if it's too late, that might be loss of a chance of having children.
Yes, as long as early enough.
Yeah.
Yeah, as long as early enough. Just normal, you can just do a normal comb biopsy to take care of it, or you do your loop excision to take care of it.
Okay, so just for the purpose of people who hadn't, who weren't here in the beginning, I just wanted to say, can someone actually have cervical cancer and not know it?
Yes. Someone can have cervical cancer and not know it, because I say most of the time it is asymptomatic. At the early stage, there's no symptom. I said it's preceded by certain stages before you get to the cancer. We call that stage this cervical intraepithelial neoplasia, where you just see disordered growth in the cervix. So those times there's actually no symptom. Maybe the person just come for something else and you end up examining the genital area. You now notice this.
Yeah.
Or just on, maybe you sent a patient for ultrasound and some other investigation and you stumble on it. Some patients already have it and they don't know. It's in the early stage. It's the late stage that presents with symptoms. Patients now start coming to the hospital. Sorry, I notice I bleed anytime I have sex with my husband. Or I notice my period is getting irregularly long and heavy.
So from what you're saying, the symptoms are, bleeding either after sex or in between your periods, heavier periods, painful periods. Is there anything else that, in case anyone is saying I have some pain or I have some feeling around this, that they can use to say this might be a symptom? What are the symptoms of cervical cancer?
Okay. The first is the abnormal vaginal bleeding, which can occur immediately after sex or in between your period, like 2 weeks interval after your period, or a woman has stopped menstruating that is already a menopausal woman, suddenly presents with post-menopausal bleeding, irregular menstruation. Then vaginal discharge also. Sometimes they can present with watery, offensive, blood-stained vaginal discharge. Those are the common symptoms they present with. Then in advanced stages, like in stage 3 to 4 of the cancer, they can present with pain. That's when the cancer has infiltrated the spinal cord. They can present with weight loss. They can present with anemia from chronic vaginal bleeding. They can present with incontinence that's due to the vesicovaginal fistula, so that they bleed, they urinate the vagina instead of from the urethra, or fecal matter comes out from the vagina instead of the anus. They can present with chest pain if it has metastasized to the lungs.
Okay. So just to summarize what you just said, you're also saying that
Thank
if
you.
somebody has cervical cancer, it can actually move to a different area of the body, like the lungs, the spine, and that's usually when it starts to be quite quite bad, right?
Yeah. Yes.
Okay, serious stuff. I'm sure even I myself, I'm quite surprised by some of the things I'm hearing. Um, so I think the question I'd now like to ask is how can this really be prevented, right? How does one prevent themselves from getting to the stage if at the beginning of cervical cancer you have no symptoms, right? There's no symptoms. I don't know what's going on in my body. I feel okay. How then do I check um, that I am, that I may have cervical cancer?
That's why the screening for vaginal cancer comes in. The regular screening for it, screening starts from the age of 21 to 65, although we recommend screening from 25 years. Because before 25 years, as I said, the causative factor is the human papillomavirus, which is actually transmitted.
Yes.
The body can take care of that. It can't take care of it after 25. But after 25, when you start seeing symptoms from it, you need to treat to prevent. So that's why the screening comes in. If you do your screening regularly, like normally, if it's just the pap smear or the visual,
Please. Sorry,
okay,
Doctor.
we have
Can
the
I
pap
just say
smear
something?
or the liquid-based cytology.
Yeah.
We have colposcopy. We have the HPV DNA test. We have the Sheila test. In Nigeria, the most commonest screening we have in Nigeria is the
I believe you said is the VIA. I think let's hand over to Dr. Kende, who can give us a little bit more information about, the screening.
Okay. Good afternoon.
Good afternoon.
Okay, you can hear me.
Yes.
Okay, for the screening method in Nigeria, we actually say 25 to 64, as Dr. Laomi said. But we noticed that the sexual age is now sexual cases now earlier. Before it was, then we used to be mature before you start sleeping around. But right now, girls of 18, 20, 15, they're now sexually very, very active. So screening starts from when you become sexually active. So that is one of the things we actually got to know, that we don't have to wait till 25 again. And as we said, the screening can come in three forms, which we can do an HPV infection to check, as Dr. Olaomi has said. The HPV, we have different types. I think it's like 1 to 100 or so. But the major ones that cause the cervical cancer is 16 and 18, as she said. So someone may have HPV injection or infection and may just be genital warts, which immunity will sometimes could take over it and cure it. And if not, you go for the normal treatment for it. But when it's 16 and 18 for cervical cancer, it may take up to 15 to 20 years before it starts showing on your body. But if your immunity is low, 5 to 10 years, it can start showing by all the symptoms which you've all highlighted. So the screening can come about you checking your HPV infection, which will tell you have an HPV and all this and that. Then the other one can be acetic acid or iodine. That is a screening which is done. You see the changes in the cervix instantly when you put the acetic acid or iodine. In the next 1 or 2 minutes or 3 minutes, you see the results. It's good for someone that already knows the color change. Someone like us, that's what we do. So we know the color change, that this is normal. There are sometimes due to women that have given birth, they may have so many abnormalities in their cervix. Doesn't mean they have cervical cancer. It's just the process that's gone through that place. That's one of the things that are causing those things. Then the third one is nanny papa Nicholas men, which you do and you take to the lab to get the reading out. So that will now show us is precancerous, is now stage 1 or something like that. So those are the three major screening in Nigeria which you usually do. Thank you.
Okay, thank you so much, Dr. Kende. I would like to just go a little bit further into what you said. You talked about, the pap smears and, the VIA, which is the acetic acid, right? I know
Yes.
I personally have had a pap smear before, and, I know what it's like. Can you please explain, what is the procedure for this? I know a lot of women sometimes hear it's painful or it's scary. Can you just
It's
demystify that
not
for me?
painful. Okay. It's not painful. It's just that it's not comfortable, sincerely. So first of all, when you come and want to have your pap smear done, as we usually call this Papa Nicola smear, but call it pap smear, be relaxed. Because when you are relaxed, the thing they want to put inside will go inside well. That is the speculum. So the first thing your doctor will tell you what they want to do, and will explain the procedure to you and take your consent, which you agree. And of course, you lie down, raise up your leg. There's a way they will position the leg so that the person that wants to do it can see the cervix. I always tell people be relaxed. When you are relaxed, the muscles over there will be relaxed also. And the speculum has to enter because it's after you put the speculum, you'll be able to see the cervix, you'll be able to take the sample out. If you're not relaxed, you make the work difficult for the person putting it in and for yourself also. That is when you'll be feeling the pain. If not, you are not meant to feel any pain. Because the person that is putting the speculum will have even make sure the speculum is duplicated so it can enter well. And they take and it's just within minutes the test is done. They strip round and they put it on the slide, and that is all. And it's transported down to where to be worked on. So it's not a painful procedure. It's just that it's not comfortable. That's how I put it.
Okay, and so I think, how long does it take to get those results? I think for the VIA, you mentioned it's almost instant.
Yes, the VIA and the local iodine is instant. But for the pap smear, sometimes it may take up to let's say 5 days. In some labs, it now depends on the lab that you take up to, or you take it to, sorry. So within a period of 3, 5 days, you should get your result.
Okay. All right. I had another question around vaccines. I know that in the UK they are giving vaccines to younger people, men or boys and girls of like 14. Are these vaccines available in Nigeria? And can you take those vaccines once you're already sexually
Okay,
active?
okay. Thank you for that question. That's a very important question because there are vaccines available in Nigeria, which we also give it. There are two types of vaccines: the Cervarix and the Granusil. I've forgotten the pronunciation very well, but the second one is not readily available in Nigeria. That is the one you can give to both male and female, because as Dr. Laumi said, men are actually the main source of this thing into a woman's body, and she will not be aware of it till later. Do you understand? So in Nigeria, we have the Cervarix, and I think that's the major one, which we have, which we give. It's 3 doses. You take it the first time you see the person, 1 month after, and 6 months after. It's able to cover you for 10 years. That's injection for a person that is not sexually active. Obviously, you won't have any HPV infection in your system, in your cervix. So when you take the injection, it's safer for you. You've already covered yourself. For a person that is sexually active, you go for a cervical screening, any of the screening. When you do that, if it's negative, then you take the injection and to cover you for 10 years. But that doesn't stop your normal checkup, your normal screening, which is when you do it after some places they'll tell you 3 years, some places they'll tell you 5 years. You do that regularly to make sure you're negative. But with the injection, it has covered a lot for you.
So what
So
you're
if you're sexually active, you make sure you do your screening before you take it.
so what you're saying is that even with the injection, there's still a chance. So you should still, get a pap smear, even
Hmm?
though you've had the vaccine. Are you saying that even though you've had a vaccine, you should still, get a pap smear because nothing is hundred
From
percent?
research, for those that are taking the vaccine, most of them don't come down with the cervical cancer. From research, many of them didn't. No, but never say never. You understand? But it covers it. At least the work is almost like 9% from research.
Okay, so I have a question around whether Um, there's a bit of noise. I'm trying to find where that's coming from. Okay. I wanted to ask, so where can one go to potentially get, whether it's tested or vaccines? What does Nigeria offer? Are there any free places? Are there any affordable places that people can go for these sorts of tests or vaccines?
Okay, thank you. Sincerely, there are many free places. There are some free places and there are some places you have to pay for. And government has been good to some extent. They've been providing some general hospitals, some primary health centers, because some of these midwives and extension workers, they can take all these samples. So the acetic acid and lugo iodine, because some World Health Organization have even sponsored some centers with all these things provided for them so that they can have the screening done there. So extension workers and so many people have been taught. So you can go to general hospitals, you can go to teaching hospitals. Teaching hospitals may be difficult because of the large volume of things going on there. But general hospitals, primary health centers, and some private diagnostic centers actually do it. And for someone like what we also do, my own place is Care for All Medicals, in which you do screening. It's part of what we do. So there are so many other people that they do it, and it's not so it's affordable to some extent. Let me try to be inside of caution concerning fee, depending on the place, but government made it for government hospital is more or less like free. The only thing you pay for is for the card or any other thing. But for private only, you just pay some token. But there are some NGOs that do it for free. I think there's one NGO in Surulere. I've forgotten the Optima also. I think they do it free there.
So
And some
in
other
your
people,
organization, how much does it cost to do it?
it costs 3,000. And
Okay.
we'll do a complimentary of to check your to do a clinical breast examination with it for you.
Okay. All right. Thank you so much for that information. And about the HPV vaccine, where can anyone go and get that?
Okay, the HPV, you can find out from the private owns that actually give it, and there's government. But um, I think in government hospitals, you go to family planning area, may be able to give you information of how, because the vial comes, we give it also. The Just like the one we give is per person. And there are some that they may have like for like 10, no, 5 people. We don't usually get there. The one we get is one per person. So you can get it at private places and general hospitals and primary health centers. They'll give you information concerning it.
Okay.
But
All right.
we do give also.
Okay. Thank you so much for that. I think we actually have quite a number of questions collected before the with the registration form, and we have I think one on the in the call at the moment. Fee T says, "Hello, but I hear the HPV vaccine is only for people who have never been sexually active. Is this correct?"
No, for sexually active, you make sure you first. You have to, that's what I said. You have to make sure you go for the screening and make sure you are negative before you are given. It also covers for sexually active.
Okay, thank you. And then we have Joke has said, "Good afternoon, everyone. Please, what pH infection?" I'm not sure if anyone understand. I don't know if that makes if you understand that, Dr. Kende.
Okay. What's pH? Is that what she said?
Yes, it says what's pH infection?
Okay. pH, as I'm saying, means human papilloma virus. Human papilloma virus is an infection in which I told you there are like 1, 2, 3, up to 20, 30, 40. But for the one that causes cervical cancer is 16 and 18. But for human papilloma virus 1, 2, 3, if someone has it, it can result in what we call genital warts, anal warts. That wart is your pelvic area. It will be like a leaf. There's some people that have that infection. It will be like a leaf. That's what we call genital wart. So the other human papilloma virus can cause that. But the one that is 16 and 18 causes cervical cancer. And that is what the injection you are giving, that is why is going to prevent the one that causes 16 and 18, the cervical cancer one. That's the function of the egg. cervical injection.
Okay. There is another question that was previously asked. It says, well, I think you've answered this. Is HPV vaccine a one-time vaccine, and that can the vaccine be taken if pregnant?
No.
Okay, HPV vaccine is not one time. As I said you take the at contact first time, 1 month after, and 6 months after. But when you are pregnant, I would advise you to take it because any reaction can occur. Pregnancy state is a very, very sensitive state. So you just don't want to do anything that can cause anything. So it's better when after you deliver, then you can go for your test, then you take your vaccine.
Okay. Then we have another question that says, how long does the virus stay in the body before it becomes cancerous?
Okay. As a young girl, imagine you have it. The person has HPV. HP. Okay, human papilloma. I want to try and stop saying HPV so that people can get it. Human papilloma virus, 16 and 18. It stays in the body because she's still young. Immunity is still strong. It stays 15 to 20 years. So it's likely when she's 40 something or 50 something, she starts bleeding. All of a sudden, before a period, she starts seeing the blood. But in case she has HIV, which is that one will reduce the immune system, it can come up within 5 to 10 years. After 5 to 10, or 10 years, she starts having all the symptoms: vaginal discharge, bleeding before period, during intercourse, after a period, or after menopause. Oh, the vaginal discharge will be foul smelling and so many other symptoms. That is when all those symptoms will start occurring. So it takes 15 to 20 years. It's not as if when you have it now, then instantly you start the symptoms. No.
So even if
That's
you
why most
have the
times you see
symptoms, right? But you'll still be able to see it in the tests, right?
ma?
I said, even if you don't have the symptoms, if you get tested, it will still show up on the
Yes, yes. The screening will show because the cervix will have been something would have happened to that cervical region. So you'll be able to see some things. Something like the papanicula and the acetic acid, you will see the difference that no, there's something wrong with this cervix. And when you do the pap smear inside the cells, they'll see that they're abnormal cells because it has already turned to cancer. So obviously the cells will be there.
Okay, so as a question around age, so I know we mentioned a lot of what we've talked about is around your period and being extremely sexually active. So what if you're a little older? So you're in your menopause now. Can you still at that point acquire cervical cancer if you hadn't had it before, or you've been getting negative tests up to say 45, 50, and you're still sexually active afterwards? Can you still get cervical cancer?
Yes, yes, because the age is from Nigerians age 25 to 65. So if you are 45, you're still sexually active. You are doing your screening, it's still negative. You won't stop the screening. You still continue the screening till you're 64, 65, and your result then is now negative. So
Okay.
probability of you asking is very low. But when you're still 45, 50, you can still have it.
Okay, there's a question
So you
around.
have to continue screening yourself to make sure.
So I think the follow-on from that is advice for people above 60 years, right? So I think what you're saying is till you're 64, keep getting tested.
Yes,
Yes.
thank you. Thank you very much. Yes.
Okay. Someone asked the question, at what age should one be afraid of having cancer?
At what age should one be afraid of having cancer? There are different types of cancers. Cancer can come at any age now. So taking care of your system, of yourself is the first thing. Try once in a while to do some certain, when you see any changes in your body, take note of it. Because there are some, one of the cancer one can cure is cervical cancer, as Dr. Olaomi said, yeah. But other cancers is not like that. But when you see that you're coughing differently or you're bringing out blood when you cough, of course, quickly go and complain. There's something wrong within the system. When you see any abnormalities in your body system at any age, just take cognizance of it, because there's family history of cancer. If a family has breast cancer, colon cancer, anal cancer, so you're prone to any other cancer. So we have to learn to always check our body system.
Okay. So there's some questions here that I already have answers to. It says, can someone who's already predisposed to symptoms of cancer still get the cervical cancer vaccine? I think you've answered that already, in that it would not be advisable to get it, unless you've tested negative, right?
Yes, you have to, yes.
Yes. The other question was, can cervical cancer spread outside of the cervix? I think Dr. Lamy also talked about that, it can spread to the spine,
Yes.
the lungs. Is there anywhere else it can spread to?
Oh, so many other places, the brain, so many.
Oof.
It's cancer, so it moves.
Yeah.
But there are some places that it really likes and sticks to.
Someone said, how do I take care of my vagina? I think in light of everything that we're talking about.
Okay. First of all, taking care of your vagina involves, first of all, it starts with hygiene. Your self-hygiene matters a lot. Then touching. Don't. When you want to clean your vagina, use water. Clean water alone. Using all these medicated soap and other things, they kill the bacteria God already put there. There are some bacteria that are already dead, like soldiers for us. So when we use all this cream and others to wash our vagina, we kill them, exposing the area. So that's why we encourage that you should use water to wash your vagina. Sometimes during period, you may feel dirty that you need something like soap. I will only encourage someone to just use a mild soap. That's what me, I'll encourage someone that just use a mild soap and that's enough. So, but majorly it should be water. Then hygiene. Then, of course, good eating habits, fruits and vegetables. We always increase your immunity, and when your immunity increases, it helps the body system. Then we just don't open our body, our vagina, tease ourselves just anywhere. Then once in a while, we should learn to change our pants, and some people use panty liners and all this. And when you have any vaginal infection, treat it well. Just don't treat it halfway and go. Treat it well, because when you don't treat it well, it moves up. There is what we call pelvic inflammatory disease, and it's caused by ascending infection. So when you have vaginal infection, treat it well. And that's all. That's the simple thing. That God has already protected that place. It just remains for us to just be careful about it. That's the major thing about the vaginal treatment.
Okay, thank you so much, Dr. Kennedy. Dr. Lam, is there anything you'd like to add to what's been said? But in the meantime, before you respond, I wanted to launch a little poll to find out how we're feeling about being tested. I'd appreciate if everybody responds. I've launched it now. But yeah, Dr. Lam, is there anything you'd like to add in terms of care of the vagina while the poll is going on?
Okay, thank you very much for your question. Dr. Kennedy has said virtually everything for vaginal care. He has even gone to areas I wasn't even thinking of when the question was asked. So I think that's enough for vaginal care.
Okay.
Then the few thing I want to ask on that prevention of cervical cancer is vaccines. They should stop smoking because of the immunosuppressive effect of smoking. Then for younger ones that are just coming up, if possible, they can delay the age of first sexual intercourse. Sex is not actually a really big thing, but after experiencing it, you tell yourself, is this all that exists to it? Then they should also try and reduce the number of partners for those that have multiple partners. Those will also, these few things will also go a long way in reducing the risks of having cervical cancer. Thank you.
Thank you both. We have a question in the chat. So someone has asked, I'm a bit confused, Dr. Kainde. Does this mean cervical cancer can be sexually transmitted, as HPV is a major cause of cervical cancer and it's sexually transmitted?
Yes. Okay, yes, let me use this example. A man is married. His first wife died of cervical cancer. Unfortunately, it's the man, because it's inside, as Dr. Lahami said, the HPV is inside the seminal fluid. Do you understand? So it passes to the wife. The man doesn't have any problem, but the wife developed the cervical cancer, which is because she had the HPV 16 and 18. The man marries a second wife. Obviously, it will transmit it to the second wife. And if it's still HPV 15 and 16 and 18, she too should develop cervical cancer. So it's sexually transmitted.
Thank
Is
you.
that example explanatory enough?
Yes, I think so. I would, comment if you feel like you want any more sort of feedback on that. But we also have another question. It says, is there an HPV screening available for men as well?
Yes, they'll have to go to the centers, to the hospitals, so they'll screen them. Yes.
So how is that screening done? Is it a blood test? Is it one?
HPV. Okay. That's a good question. Oh, HPV, which we usually do, usually done for women, because they'll have to go through the cervix. But in developed world, in Nigeria, I'm not so sure it's readily available, but it may now. But I know in developed world, there are many things, blood and every other thing that can be used. But in Nigeria presently, is majorly they use the um they go through the cervix to stain it. I'm not very sure for me. Well, it may have I will go through. I will actually take it to be very sure.
Okay,
But I know it's through the cervix.
so I think at this point, I'd like to find out if anybody has any other questions. I think we've really kind of discussed cervical cancer, what it is, right? How it presents. It doesn't have any symptoms in the beginning. It can present symptoms 10 to 15 years after it has been contracted. And those symptoms can be anything
Yes.
from, pain, bleeding, during sex, even just something that looks like your normal period. That could be a sign of, cervical cancer.
Yes.
There are different ways to test, right? You can have
Yes.
the pap smear. There's also
Yes.
the VIA, which is the
Yes.
nucleic acid, which can give you instant results
Yes.
on your cervical cancer.
Yes.
And one of
Yes.
the biggest that I saw today is that 311,000 women died in 2018 from cervical cancer. I didn't believe
Yes.
that until, I also did my research and saw that was really true. It's quite a scary number. In some of the research I saw, I also called it the silent killer because of the asymptomatic,
Yes.
yes, status of it, right? So the ways in which people can
Yes.
prevent it is, by early testing, testing regularly. I
Yes.
think myself, I get tested every 3 years, right? But I know as you advance in age, it's usually recommended to test on an annual basis. The cure
Yes.
for the disease could be anything from, a minor surgery to complete removal of the reproductive organs. So the earlier, the better. The later, the more dangerous
Yes.
it is for the woman. I think we talked about risk factors. Risk factors were, being sexually active, potentially smoking nicotine, also having multiple partners or having a partner that has multiple partners, right? That's another big one because I know a lot
Yes.
of us women might think, okay, well, I have one partner, but we also have to make sure that that partner doesn't have multiple partners who may have, that who may have that virus in them. And we're saying that you can get tested, as I said, with the tests, the VIA test, and those are available at the primary care centers or general hospital. And
Yes.
even Dr. Kennedy has a center called, is it Care for All?
Care for all medicals.
Yes, Care for All Medicals, and I think we'll send you that information afterwards on the via email for those who have registered. But I think at this point, I'd just like to say thank you all for your time. And thank you so much for attending this session. Hopefully we'll have more of it to just talk about things, whether it's women's health, men's health, children's health, so that we can all sort of understand, what do we need to do to ensure that we are living healthier lives. And that's kind of what Waziki stands for. Waziki is a platform that connects doctors or medical support to people that need it. The website is wazikilife.com. Feel free to register. Dr. Laomi is one of the doctors we have on our system. Dr. Kende, we will work on her. Hopefully she will join us shortly. And yes, and that's all. So thank you so much. If you have any questions, you can email us at hello@, wazikilife.com. Thank you and have a great afternoon. If there are no other questions, I'm going to end this meeting.
Thank you. Thank you very much.
Thank you, everybody, for all your time.
Thank you.